Welcome back to McLaren Port Huron's Today's Health Program. Today I'm speaking about lung cancer with Dr. Alsawah. Doctor, before the break we talked about how smoking is a significant risk factor for lung cancer. Now, at the time that you're diagnosed with lung cancer, is there any benefit to quitting smoking at that time?
Thank you for asking. It's a very, very important point that, to be honest with you, we were not aware of how important it is for the patient to quit smoking even after they're diagnosed. We used to think that whether the person quits smoking or not, the damage is done. But we found out that probably the nicotine in a cigarette doesn't just help cause the cancer, but actually feeds into it. So if the person continues to smoke through the treatment, their response to therapy, and which means outcome, is going to be less of that if they quit smoking. They have much better chance of doing well if they quit smoking. So some people, some centers, and I know a lot of surgeons that would not operate on somebody that continues to smoke, would not. So some centers now started saying that we're not going to treat you unless you quit smoking. So it is extremely important for the patient to quit smoking despite being diagnosed with lung cancer.
Wow, that's good information to know. So once diagnosed with lung cancer, what are the treatment options that are available?
There are multiple. Historically, the treatments are the best treatment there is, we know, is surgery, is to remove it surgically. But there are other treatments like radiation therapy and chemotherapy. If you go back in time, that's the only 3 treatment option. But nowadays we add immune therapy, targeted therapy, so the list is multiplying. So there's multiple options to treat.
And how do you determine which option is the best for each patient?
And that's a very good point. I mean, it takes a team effort. We need a team from medical oncology, radiation oncology, a surgeon, and sometimes other specialties too, and the lung doctors. We all have to meet together, and we just started that in McLaren in Port Huron, where we have the lung tumor board, where we meet regularly and we discuss those cases together in one room, and we recommend a treatment plan and treatment outcome. So it's a team effort that's the most important.
Now, have there been any advances in the treatment of lung cancer over the last couple of years?
Sure. Advances, all of these options we talk about, there have been advances in that. So for example, surgical, even though I'm not a surgeon, but now they can do surgery with a minimal approach, like minimal technique. They just with a scope, just like they do the gallbladder with the small teeny openings. Some of them with a small cancer, they won't have to cut the chest wall, they can do that. Radiation is amazing, new techniques, and a lot of systemic treatment, not just the chemotherapy, but a lot of immune therapy, targeted therapy that's are now more guided towards certain cancers than others. We don't have the generic approach to lung cancer that we used to be. It used to be one treatment approach. Now we try to actually tailor-make the treatment that fits that particular cancer, that particular person, for the better outcome.
Wow, that's great. So with all of these different variations in treatment for lung cancer, is there a cure?
Of course. The best cure is to find it early. And the best cure is to avoid avoid the risk factors, basically. Like quitting smoking is the best thing you can do for yourself, because that will take away or minimize the risk of lung cancer happening altogether. But if we can find the cancer at the earliest stages, stage 1 and 2, and some early stages 3, then definitely that will help cure the patients. So we tell the patients that when symptoms happen, don't ignore it. Please go to your primary doctor, to the hospital. If you're worried about it, come to the emergency room. But let somebody check you over. This cough that's been nagging for 6 months and not going away, don't just think it's from smoking. Don't just think it's because of the viral infection not clearing. Just go and get checked out. So early diagnosis at earlier stage, but the best thing, avoid it altogether, is quit smoking.
Dr. Alsawah, this has been great information for our viewers today. Do you have any closing comments?
Yes, I mean, I want to tell patients and the population that even though this is a killer, but we are making great progress, great strides, and I think in the next 10 years the statistics are going to change to reflect the advances we have and to the general knowledge what smoking can do. And this great treatment and new treatment we have is going to all lead to decreased rate of the cancer and decreased rate of death from lung cancer.
Doctor, thank you for joining us today.
Thank you very much for having me.
Stay with us. We'll be back after this message.